When you are told you need a hip replacement, the medical system often takes over. You get a diagnosis, a referral is sent off, and you can feel like a passenger waiting to be assigned a date and a doctor. But the gap between a smooth recovery and a joint that requires revision surgery down the road does not come down to luck. It relies heavily on the specific hands performing the operation. You face an immediate choice. This flowchart shows the two distinct paths you can take: passively accepting your default hospital assignment, or taking the time to proactively select your surgeon. Taking the default route gets you a faster initial booking, but you take on a hidden risk. You have a much higher likelihood of being assigned to a lower volume surgeon. If you want to avoid future revision surgeries and protect your long-term mobility, you have to step up and act as your own healthcare project manager right now. To show you exactly how to do that, we are using the 2026 framework from The Best of Health, the UK's resource for over 50s navigating major healthcare decisions. Here is the core medical reality. The titanium and ceramic hardware used in your hip matters, but your surgical success is overwhelmingly dictated by how many times your doctor installs that hardware every year. This chart shows exactly why volume is your best protection. The data consistently shows that selecting a surgeon performing 50 to 150 or more hip replacements annually results in sharply lower dislocation and infection rates. Reaching that low-risk threshold requires a trade-off. Accessing a high-volume specialist often means you have to travel further to a specialized clinic or wait longer for an open slot on their list. Sitting on a wait list or driving an extra hour is a temporary inconvenience. It is a small price to pay for a joint that functions reliably for decades. How you find that specialist depends on how you fund the surgery. We can look at this side-by-side comparison matrix to weigh the NHS pathway against the private pathway. On the NHS, you use your legal patient choice rights to select a specific hospital trust. Your inputs are a zero financial cost and the ability to choose a trust with an optimized wait time. The constraint is control. There is no guarantee you get a named consultant. Your procedure might be assigned to whichever doctor has an open slot, or performed by a registrar under supervision. Moving to the private column, you pay out-of-pocket or use insurance. In exchange, you secure total control over selecting your named consultant, and you can force a rapid care timeline. This route requires significant capital. It also shifts the burden entirely onto you to verify that the independent hospital is actually safe. Neither route is inherently better. You simply have to build your strategy around the specific constraints of the path you choose. Regardless of which path you are on, the Best of Health research team recommends running your prospective surgeon through public medical databases. Your first stop is the National Joint Registry. Since 2002, the NJR has recorded the data of every single hip replacement performed in the UK. Pull up your surgeon's profile and look specifically at their personal revision rates. You want to verify that their numbers sit right at, or ideally below, the national average. Next, search the GMC register. Confirm they hold a current license, and look for the checkmark stating they are officially on the specialist register for trauma and orthopedic surgery. Combing through these databases takes an evening of focus, but it is the work required to identify potential red flags before you ever put on a hospital gown. If you are taking the private route, vetting the surgeon is only the first half of your job. You will typically pay between £150 and £250 just for an initial consultation. Use that meeting to interview multiple candidates before committing to the full procedure. While you review the surgeon, use PIN, the Private Healthcare Information Network, to pull the patient feedback and complication rates for the specific hospital they work in. This diagram highlights a crucial infrastructure check. A brilliant surgeon operating in a facility lacking intensive care backup is a risk, particularly if you have a complex medical history. Manually verify the Care Quality Commission rating for that specific independent facility. Private capital buys speed and choice, but it does not guarantee safety unless you rigorously audit the building alongside the physician. When you finally sit down for the consultation, treat the surgeon as a candidate you are interviewing for a highly specialized job. Bring a consultation scorecard into the room. Ask directly about their complication metrics. A competent surgeon will confirm their infection rate is below the 1% standard. Ask them to justify their specific implant choice, tailored directly to your bone quality. Asking direct, challenging questions can feel awkward. We are conditioned to nod along with doctors. Ignore the awkwardness and watch for red flags. If the surgeon dismisses your questions, seems rushed, or skips exploring conservative treatments like physiotherapy first, you should walk away. Avoiding social friction in an exam room is not worth the risk of going under anesthesia with a doctor you do not fully trust. The time and energy you invest in proactively vetting a surgeon right now is the highest return investment you can make for your future mobility. You now have the exact framework required to evaluate your options and choose your surgeon with absolute confidence on any budget. To utilize our UK hospital directory, compare private prices, and read more definitive planning guides, visit The Best of Health at thebestofhealth.co.uk. Joint replacement is a major life milestone. Taking control of the roadmap today is your first step toward getting back to the activities you enjoy without the constant shadow of pain.